So what should somebody look for in a dentist that's going to be doing their dental implants?
When choosing the dentist or the surgeon who's going to place my implants, what you want to look for is someone who has experience, has education and training. And it's part of the curriculum in oral surgery residency that you have to place implants and have to understand the bone, because that's the foundation.
Because you've been doing implants since the 90s.
Since 1990, 30 years, Randy.
Is there a huge learning curve?
There's a massive learning curve in learning how to deal with the different bone densities, the bone quality, the placement, the different structures that you need to avoid. If you don't have the training, you can get into trouble very quickly and cause premature failure of the implant if it's not designed properly.
So do you believe an oral surgeon should be doing your implants?
Well,
or part of the team?
If you look at the success rate of an oral surgeon, it's across the board in the United States, it's 95% success rate. In general dentist population, it's 83% success rate. The success rate alone would get me motivated to go with a board certified surgeon.
Because when things happen at other offices, complications from implants or whatever, they end up in your lap. Is that true?
We handle all the complications.
Okay.
So we're the end of the road. We're the bridge between medicine and dentistry, and we see all the complications.
You say it doesn't cost more to go to an oral surgeon, so why not? I'm paraphrasing you, but...
Well, it doesn't cost more to do the right thing from the beginning. So it's more expensive if you design it poorly and you have a failure, versus if you do it right, it's going to cost less because you're not going to have to redo anything. It's going to be more of a better foundation and better outcome long term.
So should you ask your dentist, like, how many implants have you done? How often do you do it?
I think it's critical. Just if you're going to have your knee or your hip replaced, you don't want that doctor staying in Motel 6 and come in there and expecting to place that implant, and he's only done 2 of those in the past 10 years. So same thing here, experience is everything.
You said at the green room, and you actually said, it's a little scary what's going on out there. That means guys taking weekend courses and then doing implants. Elaborate on that.
It is very scary. If you look at the amount of implants a general dentist, the average per year is just under 15. Where in our cases, we're into hundreds, if not thousands, of implants per year. I have placed over 10,000 implants in my career.
Okay.
So there's nothing better than experience.
Makes a big difference.
A huge difference.
Is that why you could do it so quickly? That means what takes other guys like 9 months, you do in like a couple of visits.
Well, whenever you're able to extract a tooth and place the implant at the same time, it's a big benefit over a general dentist that rarely does something like that. It's a lot more complex. And so we're actually speed up the whole process. The healing process, the aesthetics, the function, everything's better if you actually place the implant at the same time. Most general dentists are not capable of doing that. They don't even know, some of them don't even know it's an option.
I have guys that come on my show and off camera, they say, Randy, let me tell you something. It's better if you remove the teeth, sew it back up, I guess, wait like 6 months and then do it. But you say no.
No, that's not true.
That's like the old-fashioned way?
That would be it would be an old-fashioned technique.
But they do it all the time now?
We do it all the time. We thought that if by covering it up we were protecting the implant. But where in fact we actually decrease the amount of soft tissue coverage that we're going to need for later. Because a lot of that shrinks. And so reconstructing the soft tissue makes it a lot more difficult.
Soft tissue meaning gums?
Gum tissue.
Okay. So taking the teeth out, same day, getting your teeth again.
Less surgery, better cosmetic as far as the gum tissue and the emergence of the tooth out of the gum tissue. It's better, it's prettier, it's stronger, and that's the only way you would ever do it for all my colleagues, both dentists and hygienists, is probably take the tooth out and place the implant at the same time.